Good morning or good afternoon, everyone. That depends where you are, because by chance we have people from everywhere in the world today at this meeting, which is amazing. I'm Jacques Pecard from GC Orthodontics, and I'm very proud today to announce that Dr. Antonino Secchi will be the leader of this winter webinar session, the first one, because before it was fall webinar session. Thank you very much, Antonino, to be on stage at 5:30 time in Philadelphia. And that's great, because it's a good time for us on a Friday to have a webinar. So we can see that we have a lot of registration today. So that's a good thing. We have the chance also today to have on board Suzanne Duval, which is from also GC Orthodontics and a CCO manager for Europe. And she will be the moderator of this session. And she will explain you all the tip and tricks to prepare your questions at the end of the session. The session will be around 45 minutes. And then after that, Suzanne will ask your question to Dr. Antonino Secchi. I think Suzanne has some very good information to give to you for the future of CCO in Europe in the next months, because we have many things prepared. And so I will give the microphone to Suzanne. I wish you a nice webinar, and see you at the end of the session. Have a nice day.
Thank you.
Bye-bye.
Thank you, Jacques. Well, as Jacques mentioned, my name is Susan Duval. I work for Clinical Affairs in GC Orthodontics Europe, and principally on the CCO program. Thanks for joining us today. It's nice to see such a great turnout. And today's section actually is first of a series of three, corresponding to our upcoming meeting in Salzburg that will be held in June 7th and 8th in 2024. Today we have Dr. Antonino Secchi, titled 15 Years of Experience with the CCO System, How to Get the Best Use of Self-Ligating Brackets and Memory Arch Wires. Before we start today, I just want to do some housekeeping here, a little bit of, what's going on. As Jacques just mentioned, today's session should have a duration of about 40 minutes approximately. This session is being recorded. You all need to know that. There are quite a lot of attendees, so mic access has been restricted. That's obviously just to take care of background noise or any unnecessary interferences. We do ask that during the session, if you have any questions, you can drop them into the chat that you can see on the lower part of your screen. Please feel free to write down your comments and questions during Dr. Secchi's presentation, and he'll address them at the end. I'll keep my eye out during the session to make sure we can attend to all your questions and comments. So on to today's session. Dr. Secchi maintains a private practice in Devon, Pennsylvania. He's a diplomat of the American Board of Orthodontics and a member of the Edward H. Angle Society of Orthodontists. He received his doctorate in dental medicine, in certificate in orthodontics, and Master of Science in oral biology from the University of Pennsylvania, the same institution where he taught for over 10 years, holding the position of clinical assistant professor and clinical director of the Department of Orthodontics. Dr. Secchi has published in various dental and orthodontic peer-reviewed journals in the areas of treatment mechanics and the straight wire appliance. He wrote the chapter in Contemporary Mechanics using the straight wire appliance for the last 3 editions of the Graeber Van Arsdale Vic Orthodontic Textbook. Dr. Secchi is the founder of the Complete Clinical Orthodontic System, known as the CCO system to most of us, and the Secchi Institute, which provides continuing education for orthodontics in the USA as well as throughout the world. He loves to spend time with his wife and his 5 children. And he loves also meeting people, traveling, and sports. Thank you very much, Dr. Secchi, for being here and for getting up at 5:30 in the morning. And thanks for participating in this webinar series today. And feel free to start whenever you're ready. Thank you.
Thank you. Well, thank you, Susan. Thank you, Jack. Thank you, Ludovic, for inviting me. Thank you, GC, for organizing these webinars. And thank you, everyone, for attending this webinar. I hope you are all good, whatever you are right now. I know we have several countries joining, so I hope you are doing well and safe. And again, thank you very much for attending this webinar. So this is going to be a small bite of what we are trying to organize in Salzburg, in Austria. So if you want to join us in June, that would be great. We have 2 days prepared with Julia Garcia Baeza and Oliver Liebel. And we're really excited to be with you personally in Europe this coming summer. So I practice outside Philadelphia. So if you ever come close to New York or Philadelphia, you let me know. You're invited to come and join me in my office. So I've been practicing for a while in Devon. I have a solo orthodontic practice. And as many of you, we have worked a lot in the last few years acquiring different pieces of technology. We are kind of practicing what we think is a very modern orthodontic treatment. We have changed our practice tremendously in the last, I would say, in the last 5-8 years. Getting into all the technology that many of you also have, scanners, CBCTs, etc. And there's no question about that orthodontic has changed a lot. In my practice, right now we do braces and aligners, like many of you. Right now, I could say my practice is pretty much like an average practice in the United States, where we still do more braces, 70%. And that's why it's very important. It's very important to be knowledgeable, to practice a modern orthodontics, not only in the digital and aligners, but also in the braces. So I will emphasize today tremendously the 70% of what we do, which is the braces. I always wanted to have a practice that can provide quality results, can be efficient, and can be financially productive. That is very important in today's world. So my question to you is, are you happy with your result? Are you happy with the efficiency of your cases when you do fixed appliances? Are you pleased with the profitability of your practice, which is very important? What do you think? What do you think is the impact of the products that you use and how you use them in quality, efficiency, and productivity? Time is everything. I truly believe that we have to spend time doing what we love, not only at work, but also we need to have a sort of a balance, and to spend time with the ones that you love, have the time at work to do the right thing with less stress, and of course time to yourself, whatever hobby you have. In my case, I love mountain biking, but whatever you love, you have to have time for yourself too. Time management is very important, and the way that you practice clinically in your office will allow you to have more time, and we will emphasize that tremendously. So that's why I've been working so hard for so many years, trying to simplify excellence in treatment mechanics. And I'm very happy to tell you that after so many years, I think we are getting there. So if you see the orthodontic flow, if an orthodontic office, from the clinical examination until the retention, there's no question that technology has taken over basically every aspect of what we do. Specifically, the records with the scanners, with the printers, 3D printers, etc., CBCTs, treatment planning with software, and there's no question about that all the technology, indirect bonding, and everything that we have in our armamentarium now allows to have a modern orthodontic practice. But what I have seen it, very interestingly, is that even though some people have everything technologically in their offices, when it comes to treatment delivery with fixed appliances, they still struggle. They still have problems. They still kind of are practicing a not up-to-date orthodontic treatment. They're still kind of they're not utilizing the most current and modern way to practice. So you can have everything great, but at the time when you sit down with that patient and you start putting the braces or you start managing the braces, there's still some problems. And those are the problems that we're trying to solve with the treatment mechanics. So let's take a look at a couple of cases. Let's see this young kid, 11 years old, come to the office. You can see is class 2 in one side, class 1 in the other. Midlines are deviated. It's a deep overbite. So that's a typical case that can come to your office tomorrow. So you see the arches here, upper and lower. Took the records, and then we start treatment here with the upper arch with the CCO brackets and by initially arch wire 014. So we start in the upper jaw, then typically intervals between 8 and 10 weeks. We put the lower braces the next appointment. We change the wires in the upper jaw. And then we get to the 2020 bioactive wires. And then after that, we start with the stainless steel 19 by 25 arch wires. We coordinate the arches. We level the occlusal plane. We start with some rubber bands. We will cover all these step by step in detail when we are personally with you guys in Salzburg. But here you can see how the occlusal plane levels. We consolidate the spaces. We put the final arch wire, and we take the braces off. And this case basically was a 14 months treatment. And I didn't do anything different than what you just saw in this particular case. Now, that's the upper and the lower arch. That's the kid after treatment. That's the records post-treatment. And then we need to start looking at the cases differently in terms of efficiency. So this case was 14 months, but we need to go more in detail. This case was only 11 visits. And if you go even more in detail, this case was exactly 4 hours chair time. So that's the time that the patient spent in my office. What I think made this treatment a very efficient treatment. There's no question about that. We strive for quality, but also we need to take care of the time that the patients are demanding right now, and the times that your staff and you are demanding right now. So this case was 4 hours chair time. What about this other case? It's another 11-year-old kid. And I treated with extractions. So you can see sort of crowding. We remove upper and lower 5 second premolars. We put the braces, upper and lower arches at the same time, 014 initialoids with the CCO bracket. And I typically saw this case in 8 to 10 weeks intervals. We went for the 014 to the 2020 bioactive arch wires, to the 19 by 25 stainless steel arch wires, and we start consolidating the spaces. Most of the space actually was closed just by unraveling the crowding, and the remaining space, I chose to close it with power chains and short class 2 elastics. Then we start accommodating the bite with the triangular vertical elastics. Final arch wires, and we removed the braces. In this case was a 13 months treatment. You can see the upper arch, the lower arch. Final records. And when you see this case, again, digging in a little bit further, it's a 13 months treatment, but this case also was 11 visits. And actually, church time, this case was 3.7 hours. So there's no question about that. Not every single case that you treat in your office will be like that. However, the idea is to have a roadmap, is to have a treatment modality that allow you to have the majority of the cases that you treat to be very efficient. And that is basically the goal that we have with the CCO. Now, how can we do this? What is behind the scene? And I will talk to you about a couple of aspects in these 30 minutes today. One aspect that I think is very important is to understand that we have a lot of technology built into the brackets and built into the wires that we use, and we haven't paid attention to it. We got so involved in the intraoral scanners, into the CBCTs, in diagnostics and everything, that we forgot how much technology and science we have behind the latest version of the braces and the wires. So when you combine these two in the right way, you can be very, very effective and efficient. So wires, bioactive initial wires, they're not new. They came about in the 90s. And even in mid-90s, as I show in this study, they were shown to be the best wires, to have the best super elasticity. As you can see right now with the arrow, I pointed out in that article that it was published in the American Journal of Orthodontics in 1995. So it's nothing new. Now, when we combine these wires with brackets, we start talking about an interactive system. And the interactive system works extremely well in the stage 1 for leveling and aligning. And let me explain you this. These 3 brackets is just a little picture of the whole mouth. So think about that. The wire here with the brackets, the bracket can be passive, the clip can be passive or can be active, depending on the malocclusion. It's metal against metal. So the amount of resistance to sliding is not a lot. And because there is vibration, because the patient is chewing, because there is saliva, and because the wire is trying to move these teeth to recover its shape, this is the movement happen continuously. And as you can see with the arrow, that the clip will be passive in one bracket today, might be active tomorrow. And the bracket that it was active tomorrow might be passive the next day based on the arch wire conformation. And the most important part is that this allows you to decrease the inter-bracket distance as you level and align. And that is the key to leveling with efficiency, to decrease the inter-bracket distance. So let me give you an example here with this drawing. Here you have the wire that is all kind of trying to unravel this crowded arch. Of course, there's a lot of forces that the wire will produce. But the wire, because it's metal against the metal of the braces, because there's nothing attaching the wire very strongly to the bracket, the brackets can move and the wire can move within the bracket. These teeth can start unraveling, the arch wire can start conforming the arch, and these teeth can just start going to the space without causing any secondary effect. And that's why we see these in extraction cases and in non-extraction cases, where you see these quick and huge unraveling of teeth. Like in this case, for instance, that is a pretty crowded case. It's a non-extraction. I put the 014 initially, and you can see how it goes from this picture to this one in about 4 months. From an 014 to a 2020 bioactive. So the bioactive wire is a wire that is heat activated, has different forces in different areas. So has more force in the molars and less force in the incisors. It's very sophisticated. So basically, our first stage of treatment mechanics where we want to level and align. We want to correct the rotations, correct the tipping, start leveling the arches, goes really fast and efficient with this system. And that decreases the amount of time tremendously in the cases. Typically, we use, for most cases, 2 wires, the 014 initial oil and the 2020 bioactive. And sometimes we have to use a wire in between an 018 initial oil in cases where there is severe crowding. So we will review that again step by step when we meet in Salzburg. So another thing that is important to remember is that there is a clip that is very strong, has memory, and provide consistency in pushing these wires into the slot of the bracket. That's why with this particular system, you have optimal torque expression. As you can see in the photograph, you don't have to fill the slot vertically to start providing torque. We talked many years ago, this photograph, when I was doing studies at the University of Pennsylvania, where we had this bracket and the wires. And you see that that's a 19 by 25 stainless steel. The 19 by 25 stainless steel doesn't fill the slot vertically. However, the 25 dimension is pushing the clips out and the clip is pushing the wire in. So the clip is feeding the wire into the slot and keeping that wire tight there. And that is very good because that starts providing over time torque expression. And as we level the occlusal plane, the T-star basically getting the right amount of inclination or torque. And as see in this picture, in this diagram here, we need to see torque in a different way. Torque expression is not only the relationship between the bracket and the wire, but it's also how level you have the occlusal plane. It's very important. As you can see, the occlusal plane can be sort of parallel to the arch wires. So once you level the arch wire with the 19 by 25, you achieve the right inclination of teeth. In fact, we measured that many years ago, and it was very consistent in many cases. We measure the angle between the occlusal plane and the long axis of the upper and the lower incisors. And pretty much was about 57 to 60 degrees for the upper and 70 to 65 degrees for the lower. And that type of consistency is very important when you treatment plan, because you can have a case like this where it's a class 2 deep 1 where flare out incisors. By the time we level the occlusal plane and we finish the case looks good. You go to the CEF and you can see basically that the template can almost be superimposed with the occlusal plane and the inclination of the upper and the lower incisor in this case. Now we can go to a completely different case. Like this one, actually is a deep bite with a very retrocline incisors. By the time we finish, we go to the CEF and we can superimpose that template almost perfectly on those incisors and the occlusal plane. So that type of prediction is very useful, because we know that in our stage 2, where we want to level the occlusal plane, coordinate the arches, consolidate the spaces, we can provide enough amount of inclination torque in a very consistent way. And we typically use only one arch wire, and is our 19 by 25 stainless steel. That's the wire that we use also sometimes with a little reverse curve to enhance the leveling of the occlusal plane in deep bite cases with severe curve spin. So another thing that I wanted to mention that is more regarding the finishing stages is that the prescription that we developed over the years emphasize final tooth position. We can go in detail about the numbers and why we chose them, but let me put it in this way. Many of the prescriptions that people currently use, they have a lot of overcorrection for anchorage and or the wire size. Let's say the Roth prescription, the MBT, etc. So some of those overcorrections, some of those initial overcorrection for anchorage can help you at the stage number 1 and maybe 2, but they don't help you when you're finishing. And that's why sometimes it gets hard to finish the cases, because once you basically align everything level, sometimes those teeth they're not in the best optimal final tooth position. So our numbers emphasize that. And you can see in our final stage, we fine-tune tooth position and we improve the intercuspation. And we typically use the 19 by 25 braided arch wire, which is another thing that we will go in detail in Salzburg. So let's take a look at some cases. So when you can see, I try to choose completely different cases just to emphasize this final tooth position. So we have this girl, very typical case, class 2 div 1, and I'm just gonna show you the initial photograph. The patient with the arch wires, just one picture. We will review this case step by step, arch wire by arch wire. But right now, I just want to show you that, yes, we put the CCO brackets and the case was finished. So, and that again was a case that is still only 17 months. That's the final smile. Completely different case, 25 years old, more class 3. Also, we have the CCO in ceramic braces. So over the years, I haven't seen very much difference in the mechanics using metal braces or the ceramic braces with the CCO. So basically, it's up to the patients. I don't really mechanically is exactly the same. So that's the case with the braces on. That's where we finished the case. Also a case that is stuck, I think 15 months, 14 months treatment. That's 1 year post-treatment. What about this case? 12 years old, female with congenitally missing second premolars, lower second premolars. So we decided to remove the baby teeth and close the space. So that's the case with the extractions done, and I'm basically at the stage 1 leveling and aligning, and then we're gonna jump all the way to the end of treatment, 22 months treatment, close the spaces, leave her in class 1 canine, class 3 functional in the back, spaces closed. Sometimes we need to do surgery. So this is a female with class 2 sleep apnea. So that is my STO. We needed to advance the mandible about 5.5 millimeters. So I created it in the treatment about 6 millimeters of overjet by decompensating the arches. And then she had a mandibular advancement. That's the case finished. That's 1 year post-treatment. Big change in the face and smile. There's no question about it. But sometimes we do have cases that we would have loved to do surgery and we just can't because of many reasons. As you all, so we need to basically compromise treatment. And this 38 years old comes asking for a solution. Has a missing premolar and crowding underbite. So the goal was to open space for the missing premolar and for an implant and level and align and basically do all orthodontically. You see the collapse of the arches based on the missing tooth and the underbite. So that's is with the CCO braces. I just start with a coil opening the spaces for an implant, and I'm gonna go all the way to the end result here. So it was a compromise case where we were able to align and level, reform the arches, make room for an implant, and she was delighted by the treatment. That's the Pandarex. You can see the implant in place. So different cases, different ages, different ethnicities, different problems, but we are all kind of been done with sort of the same principles of efficiency, quality, and that's basically the main message that I wanted to give you today. Is that we've been we have spent 15 years working trying to provide the most efficient and consistent treatment to be able to simplify what we do, have consistency in what we do, whether you have a small office or whether you have a huge office or multiple office, where you really need consistency and you need efficiency. Time management is very important for me, specifically, as I told you, because there's so much that we can do outside the office that I don't want to spend my life working in the office. I want to spend my life outside the office, enjoying life. And but you want to feel good about what you do, and you want to provide quality. So I know this was a short presentation, a short bite of the whole system. I'm pretty sure you have a lot of questions. It is impossible to cover everything that we wanted in just 30 minutes or even 40 minutes. We're going to try to do much more in person, but there is a lot that we can provide. As you can imagine, we have hundreds of cases over the years, not only cases that you can see in full appliances, but also phase 1 treatment, which is very important for me. And also is something that needs to be thought, because sometimes it's overdone and it can be very inefficient or very complicated. So in a world where I see sometimes the orthodontics mechanics, they're going extreme, they're going on a road that is very complicated, we're trying to turn to the other side and see what tools do we have, what knowledge do we have, and how can we implement better mechanics to make treatment simple and doable for most of the orthodontics around the world. So having said that, I would like to know if there's any questions. I would like to say thank you. And I'm looking forward to seeing you in Salzburg. In fact, you can even have some information over here if you just use this. If you scan the logo, you can get some information about our 2-day course. So having said that, I would like to thank you, everybody, and I'm open for questions.
Great, thank you. Thank you very much, Antonino. Yeah, the question here is, when you use elastic ligatures around the self-ligating bracket, does that modify at all the efficiency? I mean, you know, when you put the elastics probably for colors because kids like colors.
Yeah.
Does that affect the treatment or the movement at all?
Yeah, this is a typical question. I say that think about this. If you think that the arch wires will move a lot with the brackets, let's say stage number 1, initial arch wire, first appointment, I will not place, and typically I don't place the colors. If I'm getting to a stage, finishing stage number 1 or maybe stage number 2, I mean a 2020 bioactive or even the 19 by 25 stainless steel, and most of the sliding of the bracket and the wires has been done already, I can put colors without any problems. I mean, it doesn't change anything. I've done it for years, and it's not a problem. The only time that I don't place is where I see that there will be a lot of movements, a lot of interbracket distances will be decreased by moving in stage number 1. So typically, first arch wires, I don't put colors. Then after that, based on how the alignment looks, I might not put colors, or I might just put them later in the next wire.
Further on the treatment. Okay. Another question here. In the first case that you showed, you delayed the bonding of the lower jaw. Was that because of the deep bite? And do you recommend using bite ramps at all on the incisors?
Yeah, that's a good question. So yes, in the first case that I showed, I delayed the lower bonding as I usually do it in deep bite cases. So when I have a case with a deep overbite, I typically put the upper braces first, and then in the second or even third appointment, I do the lower arch wire, and it's just more efficient for many reasons. The first one that is very easy to understand is, of course, if I put the braces in the stage number 1, the teeth will just collide, and that's going to be very uncomfortable. I'm going to have to open the bite a lot, and that might not be very comfortable for the patient. Think about always patient comfort. First appointment, braces or hygiene, and then open the bite. I mean, those poor people, I mean, are suffering. So I typically do just the upper arch, and then in a second or third appointment, I do the lower. Second is that to unravel the lower arch, to unravel the crowding of the lower arch, I need to have a good inclination of the upper teeth. You can unravel the lower arch if you don't have the good inclination. So if you start braces in a deep bite case, upper and lower at the same time, that can be a little bit tough for the lower arch to unravel the right way. So I prefer to create a little bit of an overjet in the first appointment or the first 2 appointments, and then I put the lower arch. And then the third reason, and that is completely unrelated to the case, is that's the flow that I have in my office right now, and we can explain more in detail that in Salzburg. But what I typically do when I place the braces, we have one appointment where I take the records and I play the braces in the upper arch, and that's the flow in my office right now. And on a second appointment, which is a regular appointment, like a 30-minute, I sit down, and in 10 minutes, I put the lower braces, and then so we don't have really huge appointment in my office. So the first appointment is just 40 minutes to take the records and bond the upper arch. So that's more flow of the office, and we can talk about that more in detail.
And bite ramps, do you use them?
Yeah, and the bite ramps, I've been using for a long time build-ups in the molars. I'm gonna have to probably go back to show you that, but I build up with compomer the molars. Right now I do the upper molars. I used to do the lower molars. So in the molars, I put build-ups open the bite. I think I have one case that I might be able to show you that the build-ups. Let me see. I think one case right here. Maybe this case will show you. Let me see if I can go on a. So this case you will see in the back. I'm building the bite up. I'm building the bite up in the molars, so the bite can be open and the archwire can basically work and jump the cross bite. Those teeth were in cross bite. I typically do that a lot. I don't use bite turbos. I've done it for many years, but in my hands and in my experience with people, it was a lot easier to handle the molars, the bite buildups, than the bite turbos. But that's how we do it.
Another question here. With your class 2 elastics, you're placing them on the second premolars, and why not on the first molars?
Yeah. If you have an extraction case, I will go to the first molar. If you go, if you have a non-extraction case, if the case is a very if you have the first molars and second molars engaged in the wire, and the case needs heavier elastics or a bigger correction, I typically go to the first molar. It's fine. But for most of the cases, I go to the first premolar, and it's because of the following. You need to understand that the class 2 will give you also a vertical correction of the curvus P. The curvus P will give you a sagittal correction too. So when you have a curvature in the lower arch, and that curvature gets extended, gets longer. So that's how sometimes we go from a canine class 2 to a class 1 because of the arch unravels. So you think about it, the class 2 to the second premolar will give you, when the patient opens, it will give you a sagittal correction, and it will give you also a vertical correction just in the sort of the deepest part of the curvus P. So it helps you to level the occlusal plane too. And that's why I typically use it to the second premolar.
Another question here. If the case needs IPR, what stage or wire do you recommend actually doing the IPR?
Typically, the IPR, I do it in stage number 1, leveling and aligning, and in most of the cases. Now you need to do it as, and that's a question that also is very pertinent with aligners, because aligners, we do a lot of IPR. So the IPR has to be done also in the teeth that you can, because sometimes the crowding is so much that you can do IPR. So you need to sort of unravel first a little bit, and then kind of have space for the IPR. So I typically, most of the IPR, I do it in the stage number 1. However, there are some cases that you can do IPR in stage number 2. Let me give you an example. You level and align. You are working in stainless steel wires, 19 by 25 stainless steels, and you have a lack of overbite. So then you can do a little bit of an IPR, power chain, little class 3 elastics, and you can get a better overbite. So there are situations where you can do that in the stage number 2, but most of the time it's in stage number 1.
As a follow-up question to a previous one, and then 2 others here. On the class 2 elastics, what is your recommendation about use? How many hours a day?
It's also depend. I typically use for most of the cases in the working stage, I use 4 ounces, and those are pretty heavy 5/16 rubber bands, and I tell people for most of the cases to wear them half a day. So typically at nighttime, 8 hours plus some few hours in the evenings. That's the reality. I mean, sometimes these kids, they don't bring them to school, and you know how that works. If I have cases where I really need it, and there's some part of the mechanics, in some cases, I really need the rubber band as much as possible. And then I will take a time, emphasize, say, please, I need this rubber band to be here all the time. And then you go, hopefully. So in few cases, all the time, most of the cases, about half a day. And most of the cases, 4 ounces, 516. Some few cases in stage 1 in the 2020 bioactive, I can use some rubber bands, but in those cases, I use very light rubber bands. I use 516, 2.5, 2.7 ounces, depending on the brand, and they're very light. So in the range of the 2 something ounces, then heavy is 4 ounces. Yeah.
Another question here. The case which is BSSO. I'm not an orthodontist, so I don't know.
Yeah. The
BSSO.
surgical. Yeah.
Yeah. Okay. Thank you. If you can choose, would you choose self-ligating brackets again because of the oral hygiene?
Yeah. So yeah, it's not a problem. Unfortunately, I'm gonna tell you this. The picture that I took was before changing the power chain. So you can see, and I wanted to have that picture because I wanted you guys to see the over jet. And that picture, I took it before they removed the power chain, and I typically don't do that. And so what I typically do, I take the photograph on the cases before they leave. So meaning that yes, in some adult, and they collect more plaque. So we typically take the power chain, like in her case. We open those clips every session. Opening clips take 1 minute. Every session, you open those clips, you rinse very well, you close them, you rinse again. And if you have any calculus, you can clean it. Some few adults, they collect a lot, but one of the mistakes that you can do is put the wire, close those clips, and don't open those clips in the 19 by 25. Don't open them for a few months. I wouldn't do that. I would recommend you to, at every appointment, open them, clean them, put them back again. Yeah, I mean, it's very efficient. So I mean, I still, I gotta tell you this. I mean, these are the only braces that I've been using for literally since can I remember. I mean, since 2004, the only appliances that I've used is this. So I mean, it's been almost 20 years that I've been using self-ligation exclusively. So the only cases that I have with twin brackets are the few transfers that I have that sometimes I need to finish one with twin bracket. Yeah.
Okay, and just one more question here. A doctor from Austria says greetings from Vienna, and he will be
Thank you.
in Salzburg also. But he says, by the way, I use speed super cable wires in the first phase for leveling, and I leave them in for 10 to 12 weeks. Do you use only the wires you showed?
Yeah. So I was trained with speed brackets too at the university. Believe it or not, we had a great instructor from Canada, and I used to come every month to UPenn, and he used speed brackets. So I'm familiarized with the cable wire and with the D wire and many other wires. So the only wires that I use are these wires. To be very honest with you, I would say that I'm gonna mention this in Salzburg too, but there is a newer wire that if you use the cable wire from Speed, maybe you would like to try this wire that I'm gonna mention it to you. Is Initialoy. It's actually a bioactive. It's a bioactive round wire 014 light. This wire is an 014 heat activated with the same properties of the bioactive, so has more force in the back than in the front, and it's very light, very light. So knowing that you use the cable wires, if you try this one, it's called bioactive 014 light. You would like to. It's a very, very good wire. Yeah. Specifically for very crowded cases.
Nice recommendation. Thank you. Thank you. Well, I think that basically, I'm reading the last thing. Okay. Nothing. I guess with this, we'll just sort of wind up this session for